TMJ4, removing a splinter can be considered surgery. At least that's what a Mukwonago family found out when they got a big medical bill.
The complaint came into our call for action office, and consumer investigator Kristen Byrne took on the case.
After their daughter got a splinter on her foot over the summer, the Prigge family tried to remove it themselves. That didn't work. They figured the ER or urgent care would leave them with a big bill. So instead, they went to their primary care physician. The outcome, far from what they expected.
It was an easy procedure.
It was an easy procedure. We were in and out of the office in 15 minutes.
A $30 copay for an office visit is what Brian Prigge says it first cost.
We had to go to the doctor and get out.
For a doctor to remove his daughter Maddie's splinter at Freidert's Westbrook Health Center in Waukesha.
I think it was like...
He says the doctor didn't end up getting all of it out, but that is not what he's angry about.
And then we got the bill. That bill was for the remaining balance of $377.49.
What went through your mind when you saw that price tag?
There must be an error.
Add that copay, the cost even higher.
How much did you end up paying for the splinter removal?
$407.49.
That was with his United Healthcare insurance. Without it, the cost was $705. The reason? Freidert billed the splinter removal as a surgery.
It says right there, surgery.
Yep. I just casually mentioned to the physician, hey, this billed as surgery. Do you think that what happened in that room was surgical? And her answer was no, she didn't believe that it was surgical.
Brian gave us the email his doctor sent him responding to his complaint, showing she tried to change the name of the procedure in order to change the billing code, but found there really isn't an alternative. He contacted Freidert asking for his case to be reviewed.
They did their own investigation.
They did their own investigation, and they came to the conclusion that because the physician used a scalpel in the procedure, that it was surgical.
Here's the final decision letter, saying the coding and charges were determined to be valid. We asked Freidert for an interview. They provided a statement saying, in part, all documentation was deemed appropriate for the care received. It goes on to say, we have offered him a payment plan if he prefers to pay in installments.
Jumping.
Maddie's foot healed up months ago. No health concerns here. Just a frustrated family stuck with a big medical bill because of a splinter.
Let patients know what they're going to be on the hook for when these issues occur. Had I known that the bill for that office visit was going to be over $400, perhaps I would have taken a different form of treatment.
Brian Prigge is not finished fighting this bill, despite collections agencies coming after him. He's filed a complaint with the BBB. He's also contacted lawmakers. I'm consumer investigator Kristen Byrne.
And contacted Call for Action, hence this story. If you have a problem that you would like help with, you can speak with one of our Call for Action volunteers reaching out by email or by phone. That's the number up there on your screen.
We'll certainly stay on top of that story for